artery stenting, and dual antiplatelet therapy, that's aspirin plus an ADP blocker, significantly lowers the risk of stent thrombosis. Dual platelet therapy is usually given for 12 months, with many patients continuing antiplatelet therapy over 2 years. Antiplatelet therapy is also important in the management and prevention of acute ischemic stroke. Just take a look at this painter here, painting the outfield wall at not the most opportune time. A black stroke of paint on the painter's cap is our recurring sketchy symbol for ischemic stroke. Antiplatelet therapy reduces the incidence of stroke in patients at high risk for atherosclerosis and in those with known symptomatic cerebrovascular disease. An antiplatelet agent, clopidogrel, is often used and can be combined with aspirin as well as other antiplatelet agents. Before we move on to these other agents, I want to mention one important side effect of ticlodipine, one of the ADP receptor antagonists, represented by this fan wearing the classic jersey of his favorite player, Ty Cobb. Ticlodipine has been shown to cause neutropenia in over 2% of patients, usually within the first 3 months of therapy. In fact, fatal agranulocytosis with thrombocytopenia has been seen as early as 3 to 4 weeks after starting ticlodipine. To emphasize this risk of neutropenia and granulocytopenia, he's holding our recurring sand timer of falling granules as he waits for his hot dogs to cook. It's even multi-lobed, like the multi-lobed nucleus of a neutrophil. Because of the above risks, clopidogrel is usually your ADP blocker of choice. When ticlodipine is used, it's essential to obtain a complete blood count with platelet count and white cell differential every couple of weeks after the initiation of therapy. Okay, our next set of antiplatelet agents also interfere with the surface receptors on the platelet. This time, however, we're going to prevent the final common pathway for platelet aggregation, fibrinogen binding to surface glycoprotein 2B3A receptors. Think of it this way. See the concessions guy in the stands holding out some fresh, steaming hot fries? Well, these are fibrinogen fries, and they're good, trust me. So good, in fact, that these spectators are taking down the concessions guy in some kind of hysterical frenzy just to get a hold of those sweet fibrinogen fries. You see, when a platelet is activated either by adhering to von Willebrand factor or upregulated thromboxane synthesis or grabbing onto ADP, this all results in a conformational change of its surface GP2B3A receptors, enabling them to bind to fibrinogen. We've emphasized 2B3A and the name of the seating sections being completely disregarded, of course, by our hungry attendees here. Circulating fibrinogen binds multiple 2B3A receptors, cross-linking adjacent platelets. This results in aggregation and the formation of the platelet plug. Not so fast. Enter the GP2B3A antagonists, antiplatelet agents with many of the same clinical indications as ADP receptor blockers. Abciximab, for example, is a monoclonal antibody directed against the GP2B3A complex. It's depicted here by the broadcasters in the Athletic Broadcasting Company booth, the most trusted name in sports. Remember, that's ABC for abciximab. See their mics? They depict IgG molecules to remind you that abciximab is an antibody that directly binds the GP2B3A receptor. Hence, the broadcaster sneaking in and blocking the attachment of these platelet spectators to those fibrinogen fries. The other two agents in this class are eptifibatide and tirofiban. They both have fib in their names because they also prevent platelet interaction with fibrinogen, counteracting platelet aggregation and plug formation. And because eptifibatide and tirofiban have the word tie in them, we've sketched in the scoreboard here showing the game tied. Both eptifibatide and tirofiban have very short half-lives and must be given by continuous infusion, though oral formulations are being developed. A major side effect of glycoprotein 2B3A inhibitors is drug-induced thrombocytopenia, often within minutes to hours of initial administration. So in the stands next to these fibrinogen crazy spectators, we've sketched in our recurring symbol for thrombocytopenia, some disregarded broken plates. Come on, people, keep it together. I mean, this is the historic von Willebrand Field. Show some respect. Because of the possibility of sudden and severe drug-induced thrombocytopenia, the platelet count should be monitored frequently in patients receiving GP2B3A inhibitors. All right, see this woman getting a little too excited with these condiments? Well, as the blood red ketchup trickles down the clock face, let it remind you of increased bleeding time. Bleeding time is a pretty old school test used to assess platelet function. And since the drugs in this sketch all affect platelet function, they can prolong bleeding time to some degree. It's not very sensitive or reproducible or convenient, but bleeding time is still often used when identifying patients with severe hemostatic defects, such as von Willebrand disease or Glanzmann thrombasthenia. Remember, clotting factor function is different. With heparin, we monitor PTT, and warfarin, the PT-INR. Bleeding time, however, assesses platelet function and can be prolonged by antiplatelet therapy. Okay, it's time to close out this sketch with one more class of drugs, the phosphodiesterase inhibitors. Under this 10 over here is an area to sign up for baseball camp. See the words "don't foster disinterest"? Not only is it a wholesome message to our impressionable and, let's face it, excessively pudgy youth today, it's our recurring theme for phosphodiesterase inhibitors. Inhibition of phosphodiesterase leads to increased cyclic AMP, highlighted by the words "camp" at the top of the tent. Increased cyclic AMP within the platelet leads to activation of protein kinase A, eventually resulting in impaired platelet function. So like the rest of our antiplatelet agents, these phosphodiesterase inhibitors impair platelet aggregation and formation of that platelet plug. Dipyridamole is one of these phosphodiesterase inhibitors, and that's why we've designed the top of the tent to look like two pyramids. The antiplatelet action of dipyridamole can be useful in combination with aspirin to prevent stroke. Our other phosphodiesterase inhibitor, cilostazol, will be represented by this third baseman here, who lost the ball in the sun yet again. You're killing me, Smalls. Just remember, lost the ball, cilostazol. As he stands there squinting into the sun, notice how big, red, and floppy the sleeve of his oversized jersey is. That's because cilostazol not only inhibits platelet function, decreased cyclic AMP also leads to arterial vasodilation. This can be helpful when treating claudication, the intermittent symptoms of pain and discomfort experienced by patients with peripheral artery disease. To help you remember this unique clinical use, we've made some claudication dirt clods smacking the lower extremity of our inattentive third baseman. Also, you may have already noticed that the base is oddly heart-shaped. That's because agents that cause direct coronary artery dilation are associated with a phenomenon called coronary steal. Think of this kid here stealing a base while the third baseman isn't looking. In patients with stenotic coronary arteries, due to atherosclerosis, for example, the vessels beyond the stenosis are already maximally dilated and trying to get as much blood as possible. Give a direct arterial vasodilator, such as the PDE inhibitors cilostazol or dipyridamole, and you're only going to dilate all the other normal vessels, divert blood away from the stenotic areas, and exacerbate ischemia. The red coronary design of his loose oversized hat depicts this direct coronary artery dilation. Well, that brings this sketch to close. Let's go over the highlights, shall we? When the vascular endothelium gets damaged, platelets bind to von Willebrand factor with GP1B receptors, just like our batter steps up to the plate after grabbing onto that 1B bat in front of the von Willebrand backstop. This is platelet adherence. It leads to platelet activation, which includes secreting platelet aggregating molecules, serotonin, the happy face helmet, ADP, aggregate to platelets, and thromboxane, symbolized by the batter's box, COX-1 synthesizes thromboxane from arachidonic acid, just like head coach COX-1 sends the AA Little League leaguer into the batter's box. COX-2 will be more active during our NSAID sketch, I promise. Aspirin is depicted by the aspirin umpire permanently ejecting the coaches from the game. Aspirin irreversibly inhibits COX-1 and COX-2 by covalently acetylating them, hence the acetylating whistle. Clopidogrel is the dog griller, snagging that fly ball just like irreversibly blocking the P2Y12 ADP receptor. Aspirin and the ADP inhibitors have established benefit in numerous cardiovascular disorders. See how puffy the aspirin umpire's face is, though? If allergic symptoms develop with aspirin, give them clopidogrel instead. Up in the stands, fibrinogen fries bind platelets together via GP2B3A receptors. 2B3A antagonists include abciximab, an antibody depicted by the ABC broadcaster Mikes, as well as tirofibam and eptifibatide, which we highlighted by the scoreboard showing the game tied. Their major side effect is thrombocytopenia, hence the broken plates strewn in the stands. The last two agents, dipyridamole and cilostazol, are platelet phosphodiesterase inhibitors as indicated by the don't foster disinterest sign under the dipyrimid tent. This increases cyclic AMP and inhibits platelet aggregation. The Lost in the Sun cilostazol kid also highlights their ability to vasodilate. Just look at that dilated coronary crown. Cilostazol can also be used to treat claudication, depicted by the clods of dirt hitting his leg. Well, that's it. As Yogi Berra once said, it ain't over till it's over. It's over.